that is observed on 28 July every year to raise global awareness of hepatitis. This year's theme is Let's Break It Down. It calls to dismantle barriers such as financial, social, and systemic obstacles that prevent elimination of hepatitis.
Barriers such
In
as
this regard,
financial,
Department of
social, and
Health
systemic obstacles that prevent elimination of hepatitis. Barriers such
In
as
this regard,
financial,
Department
social,
of
and systemic obstacles that prevent elimination of hepatitis. Barriers such as financial, social, and systemic obstacles that prevent elimination of hepatitis. Barriers such as financial, social, and systemic obstacles that prevent elimination of
expert in the field of Ayurvedic medicine. Sir is currently working as an associate professor at the Faculty of Ayurveda and Faculty of Medical Science, Banaras Hindu University, via an expert professor. Sir has completed BA from 2000 from Beautiful State Ayurvedic University. In Kayachikitsa, contributed to and the Ajay Award. Sir has also received many awards for his valuable work in Ayurveda. We are very grateful to have him with us today to share his knowledge on advanced management of hepatic disorders. Sir, we warmly welcome you and we look forward to learning from your experience.
Thank you, dear, for your kind words. Can I proceed?
Yes sir, please. नमस्कार सर, शुरू कीजिए.
Can I proceed?
Yes sir, please. नमस्कार सर.
Please present over here.
Yes sir, please. नमस्कार सर.
आप पटेल आयुर्वेदिक कॉलेज आनंद गुजरात.
Please. नमस्कार सर.
आप मेरे एचओडी डिपार्टमेंट ऑफ कायचिकित्सा गुजरात and my fellow colleagues of the department of कायचिकित्सा and here is my fellow colleagues the survival to protect liver the survival from various budgeting factors. Liver the survival in the contemporary medical sciences. The approach of management of hepatitis disorder are not up to the mark. Medical sciences. That is why the researchers are inclined towards survey to evolve liver medical measures for the benefit of hepatic disorder. Towards survey in this approach, management of share of life. Towards survey in this approach, management of towards survey in this approach. We can share this after August developing.
Yes, sir. The screen is not visible yet. Your slides are not visible. It might took, sir. The screen is not visible yet. Please share the presentation. It might
Trying to say that it is not open. Trying to say that it is trying to say that it trying to say
can you please send it to me, sir? I will share it. Yeah, now it is visible. Can you please send it to me, sir? I will share it.
our site.
Can you please send it to me, sir? I will share it.
It is visible at your site.
It is you are presenting like screen. Yeah, now it is visible. Sir.
Okay.
Yes, sir. It is you are presenting like
So, and before going in detail about the hepatic disorder,
it
I
is
felt
presenting like
immense pleasure before going in detail about the hepatic disorder to convey our regards to our Acharya Charak. Today is Nag Panchami and also we are celebrating Charak Jayanti. This is all for the for this Charak Jayanti and Nag Panchami Puja. Wish you all the best. Our presentation part. We already have considered that hepatic disorder are certain that affecting the liver cells by a different mechanism like inflammatory mechanism, infectious, metabolic, toxic, autoimmune, and neoplastic pathology. Approximately at the level of world, approximately 2 million deaths annually die due to liver disease, according to WHO. And it is 11th leading cause of death worldwide. The recent decades have shown a rising trend of non-alcoholic fatty liver disease, hepatitis, cirrhosis, hepatocellular carcinoma, etc. These disorders are rising given alarming rate with the change of our living standard and the use of contemporary diet and lifestyle. Modern medicine provides accuracy in the diagnosis, but its approach of management is still vague in case of hepatitis. We are only limiting the cases of hepatitis like hepatitis A, B, C, D, E, G. These hepatitis are not manageable because of large extent in contemporary medical sciences. That is why scholars are inclined towards Ayurveda or other system of medicine. That is why scholars are involved on newer remedial measures for the management of hepatitis type of hepatitis. Integrative management enhances treatment outcomes. Like Ayurveda, modern diagnostic tools and techniques and its management integrate with Ayurvedic modern pharmacopoeia, the Ayurvedic drugs, it enhances treatment outcomes, minimizes the side effects, and promotes holistic healing. Integrate approach of Ayurveda minimizes the side effects to liver care, focusing on the root cause of detoxification, tissue rejuvenation, and long-term maintenance. Therefore, integration is the need of our care sciences. I, I here we selected some of the liver disorder like toxins, acute hepatitis. It is clearly visible in cases of viral hepatitis. Toxin-induced hepatitis like alcoholic liver disease, non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, and anti-tubercular drug-induced hepatitis, chronic liver disease, drug-induced liver disease like use of paracetamol, phenytoin, barbiturates, and anti-nature. Hepatitis B virus, it may proceed to hepatocellular carcinoma. Hepatitis C virus, it also may proceed to hepatocellular carcinoma and hepatitis C viruses. In Ayurveda, the ultimate fate of this is jaundice. The viral hepatitis mostly come in the form of hepatitis along with presence of fever and other things. In Ayurveda, the jaundice is described in the term of kamla. Hepatic disorder as a whole, Ayurveda not mentioned as such as a hepatic disorder, but Ayurveda described in the context of kamla, and kamla is of two types like coast sakhasrita kamla and sakhasrita kamla. And one is kamla is pandujanya kamla due to hemolytic jaundice. Kamla is a disease entity. It is not directly mentioned in the classics. It is described in the classical text in the context of Panduroga. So Pandujanit Kamla may be considered as hemolytic jaundice, and Kamla as a whole is considered as a obstructive jaundice or viral hepatitis or alcohol-induced hepatitis. Then the ultimate fate of Kamla is Kumbh Kamla. Means Kamla is associated with Jalodhara due to liver cirrhosis and Halimak means Kamla jaundice. These are the complication of Kamla. If Kamla is advanced, it may be converted into Kumbh Kamla, Halimak, Paniki, Alsak and Lagrak. These are described in the text of Ayurvedic to Halimaka, and then Ekrita Vriddhi. In the context of Udar Roga, Acharya Charak and other Acharyas define that there is a plihodara. If there is a vriddhi, there is a enlargement is liver on spleen on left side, and the same if it is visible in right side, then it is considered as yakrita vriddhi. Similar pattern and the similar causative factor, the causative factor of yakrita vriddhi and the causative factor of splenomegaly, plihavriddhi, is similar to the yakrita is described, and yakrita dalyodara is also mentioned by Acharya Chakrapani in the context of Udar Roga. If liver is highly compromised, he defined that what is yakrita dalyodara. Yakrita dalyodara is yakrita dalayati udaramit yakrita dalyodaram. There is a massive destruction of hepatocytes, liver cells. So these consequences may lead to yakrita dalyodara, and in modern term, yakrita dalyodara is considered as a liver cirrhosis. And the ultimate fate of Kamla in the form of ascites, Jalodhara, or hepatorenal syndrome, it may lead to life-threatening complication. If ascites is there may be a chances of renal failure, there may be a chances of pleural effusion, there may be a chances of pericardial effusion, and edema towards the dependent part of the body, and finally ultimately it may lead to death. If kamla is not managed in due course of time, it may lead to these life threatening complications, and ultimately patient goes to death. The yeah, global and Indian trends of liver disorders like non-alcoholic fatty liver disease. It accounts about 20 to 39% in general population in India. The variety of this shares the greater percentage of involvement of liver disorders. Then it seeks great attention to care about the non-alcoholic fatty liver disease. The lifestyle error and our dietary habits play a significant role in the genesis of non-alcoholic fatty liver disease because it's a greater greater number of population affected with this non-alcoholic fatty liver disease. Then come to the non-alcoholic steatohepatitis. Means steato, the fat content is accumulated inside the hepatocytes. It is approximately 5 to 10%. It is presumed that 5 to 10% of the people of liver disorder are affected with NASH, non-alcoholic steatohepatitis, but data is spare. Then alcohol-associated liver disease in India, approximately 10 to 30% of Indian chronic liver disease etiology. The whole etiology, about 10 to 30% acquire with alcohol-associated liver disease. In general population, the prevalence of alcoholic hepatitis is approximately 1 to 3%. It depends upon its drinking pattern. Along with is also localized to a certain pocket areas like Haryana, Punjab, and other state which consuming enormous number of alcohol, and they suffer from alcoholic liver disease. Then we come to the chronic hepatitis B. Hepatitis B is also a great concern. Approximately in India, 2.4% prevalence account for 7 to 8% of cirrhosis and hepatocellular carcinoma. So this account for the massive liver damage. Therefore, the special attention and care should be kept in mind at the time of management of chronic hepatitis B and hepatitis C, approximately less than 1% in general population. With some high prevalence pockets like Punjab and Manipur district. So chronic hepatitis C is also prevalent in India. Then we finally just focus the liver anatomy that we already know that after skin, liver is the largest organ in the body and it imparts larger function too. So for the assessment of anatomy of liver, the contemporary anatomy should be kept in mind at the time of management or at the time of diagnosis of a disease. So anatomical parts should be kept in mind in very right way for the assessment of liver problems, liver anatomy. What are the structural defects at the time of hepatic disorders? So liver anatomy should be known to every physician and surgeon. That we already know that the liver has four lobes: right lobe, left lobe, caudate lobe, and quadrate lobe. Besides this, liver has dual blood supply. Like 75% liver receive blood from portal vein. It comes from GI tracts, means the truncal part. Like Mahasrotas, the nutrient-rich foods also reaches to the liver, along with deoxygenated blood is also reaches to the liver via portal vein. So it acquires approximately 75% of its circulation, and the remaining 25% is oxygen-rich blood is also transported to the liver. The liver perform a very crucial act as a very important organ to digest the absorbed food material, and it converts to the absorbable form to the heart, and heart pump to the whole body parts, whole cells. And it has a venous drainage like central vein. Accumulated vein of liver is central vein. Then it is hepatic vein, and finally drain into inferior vena cava, and from where it is reaches to the right heart. In Ayurveda, only place and naming is mentioned in the textbook of Ayurveda. Like in the right side, the liver is situated, and in left side, spleen is situated, thymus is situated. So naming, only naming is not important. Naming the whole architect of liver, its venous drainage, its hepatic, its arterial supply, its lymphatic supply, and its whole architect, it is it is mandatory. Therefore, you go through the modern text to know the exact anatomy of the liver along with the physiology of liver too. Then here the discuss about the physiology. In Ayurveda, the physiology of Yakrit is mentioned in term of like it is a seat of. Do you follow me? Hello.
Yes, sir.
Okay. Okay.
Yes, sir.
In Ayurveda, the seat in Ayurveda, Yakrit is mentioned as a seat of Ranjak Pitta, where the coloring of RBCs are takes place. A liver play a role in the formation of RBCs. So therefore, liver form the RBCs, and transport of rasa and rakta. The transport of rasa and rakta is takes place. The liver play a crucial role in the transportation of nutrient plasma as well as RBCs to the right heart, and right heart pump to the lung side, and where it comes to the left heart. Left heart pump, after that left heart pump the whole nutrient plasma and RBCs to the respective tissues via different body channels. After that, the liver is also considered as a sthan of Agni. Agni, especially Bhuta Agni. The conversion of food particle up to the level of Bhuta, minor form, takes place in the liver. The liver is a important converter. So Bhutagni, Agni seat is also mentioned. It is considered an important context of Raktadhara Kala Raktasaya Raktavas Rotas. So by knowing these one, we are unable to clearly explain the exact role of liver in its physiological functions. So, for knowing the exact role of liver or yकृत and its physiological function, it is the physiological function of liver is clearly mentioned in the classical, in the modern textbook. So, liver perform. What are the function of liver? So, liver perform metabolic function like carbohydrate, lipid, protein, and fat metabolism. So it imports metabolism of, means liver convert the macromolecules of carbohydrate, lipid, and protein into absorbable forms. Carbohydrate is converted into glucose. Lipid is converted into its fine, उसमें BLDL, LDL, HDL, etc. And protein is converted into amino acids from where it is absorbed in the system. And liver also play a very significant role in the detoxification. Liver detoxify the variety of drugs, hormones, drugs like paracetamol, corticosteroids, phenytoin, barbiturates, alcoholic drugs are also detoxified in the liver. If the health of liver is not good, then these drugs create further harm to the liver or hepatocytes, and creates variety of hepatitis of its own kind. And ammonia, detoxification of ammonia. Ammonia is converted into urea in the liver. If the percentage of urea is exaggerated in the liver, it absorbs in the system and damage to the nervous system. So ammonia detoxification is very important. If liver is unhealthy, the detoxification of ammonia is not takes place and is directly hamper the functioning of brain. Therefore, in the last or advanced stage of jaundice, we feel variety of neurological symptoms, which is mentioned in the contemporary science and also mentioned in the context of Ayurveda too. Like in case of Alimak Hatendriya is the term is mentioned means the sensorial function or indriya function is totally abolished in the advanced stage of liver damage. So liver is very important organ for detoxification. Detoxification of absorbed food. Some of the ama-like reactive species is also absorbed from GI tract and it reaches to the liver. So ama-like reactive species is also detoxified by the liver. The health of liver is very crucial in this context. So it is our duty to save and care the liver. Liver secrete bile. That is why the fat digestion takes place, and liver is also excrete bilirubin excretion. So liver excrete the biles. The coloring matter of stool is also depend on the content and quantity of bilirubin. So it helps. It means the bile salt is converted into stercobilinogen in GI tract. The coloring is provided by the stercobilinogen, and in large intestine, it is further intrahepatic circulation is takes place. So any types of things which is present not useful in large intestine, the same is recirculated into the liver. Then it perform hematological functions. The variety of hematological function like clotting factors is synthesized in the liver. It is storage of blood and RBC recycling, help in the recycling of RBCs. So these are the some other important function of liver. Storage. Liver store like glycogen, vitamins, variety of vitamins like D, B12. These are stored in the liver. And some minerals are also stored in the liver like iron. Some quantity of copper is also stored in the liver. But if the storage is beyond its limit, it creates mineral-induced toxicity like iron-induced toxicity, copper-induced toxicity. It is seen in variety of clinical conditions. Variety of like copper toxicity is visualized in case of Wilson's disease. The Wilson's disease is more copper is. So copper is accumulated in the liver cell and liver cells are damaged by this mechanism. Then immunological function. Liver also perform first line defense in the like Cooper cells and defense system. The liver play a very important role. Immunological function is also important. Therefore, we can say that modern physiology, while assessing the pathophysiology of liver, the contemporary physiological function of liver is also very important. And in the same way, the anatomical structure of the liver is also very important. Before going in depth to assess the hepatic disorders, then we see the what is the main culprit of hepatic disorder in Ayurveda. In Ayurveda, here we screen out some important causative factor from the different sources of liver disorder, like described in the context of Kamla, described in the context of Udara Roga, as Yakrita Vriddhi, yeah, or in the context of Pandu Roga, like excessive intake of Pitta Vardhak Ahara, excesses because Hepatitis is a disorder of pitta. The pitta doshti is very important. The pitta vardhaka ahara may impair the functioning of pitta dosha, especially agni dosha, which is situated in the liver in the form of bhutagni. Bhutagni is disturbed. The pitta vardhaka ahar directly or indirectly hamper the pitta dosha, which is situated in the liver. Directly like excessive intake of alcohol. It directly hamper the functioning of liver in many ways, and indirectly by pitta vardhaka ahara for prolonged period. It also hamper the architect and function of liver. Viruddhahara is also very important, like incompatible food items intake of on the basis of guna, rasa, virya, etc. 18 type Viruddhahara is described in the classical text of Ayurveda. They also act as a type of Garavisha in nature. The Viruddhahara, here I am mentioned the Garavisha. Garavisha is also a type of Viruddhahara, like intake of milk with amlavargiya cheez. Amlavargiya in equal quantity. In separate quantity, it is not harmful, but if it is taken in equal quantity, it may be hamper the separate quantity. It is considered as a viruddhahara. Mandagni, weaken digestive fire. In GI tract, Ayurveda clearly mentioned that roga sarvepi mande agno sutram udarani च विशेष कर जो उदर रोग is mandagni is the causative factor of udar roga especially, but it may lead to the genesis of a variety of other disorders. Mandagni may lead to ama formation in GI tract, and in ama GI tract, ama behave as a it is depend upon the quantity and quality of ama. If ama is highly virulent in nature, in variety of clinical condition, we have seen that if ama is highly virulent, like someone is suffer from Visuchika, Alasaka, and Vilambika. If ama is highly virulent, sometimes ama is yavatannam suktatvam visrupitam. If anna food particle is not properly digested, it lead to the formation of visa-like substances in GI tract, and this visa is act as a poisonous. It act as a poison either at the level of GI tract, and if it is absorbed in the system, it may lead to other systemic disorders. Certain mental factors like krodha and chinta also aggravate the pitta component of the liver, and suppression of natural urges like vega dharana. Dharaniya vega. There are two types of vega is described in Ayurveda. One is dharaniya vega and one is adharaniya vega. The suppression of natural urges, especially adharaniya vega. Adharaniya vega, like Purisha, Vata. These are 13 types of vega are described. The vega, rogaha, Acharya Charak has clearly mentioned that all types of diseases are due to outcome of suppression of natural urges. Rogaha sarveya pijayante vega udin dhadaya. Though it means we can say that the suppression of natural urges directly or indirectly affect the in the process of genesis of disease, particularly liver disorders. So by acquiring these, we can find out these are the some etiological factors like Agni's balance at the level of GI tract or at the level of Bhutagni. It is responsible for the genesis of liver disorder. Ama formation, either it takes place in GI tract or ama-like substances formed in the liver due to weak functioning of Bhutagni. The Bhutagni function is ama is the nature of ama is described in Ayurveda in terms of Amam Annarasam Kechit. Annarasa, the substances which is present in the nutrient plasma. If it is high in amount or high in quantity or high in quality, it also behave like ama. If anything things is, if it is not properly utilized by the body cells, like glucose. If glucose is not utilized by our cells, or lipid is not utilized by our cells, yeah, or uric acid is not properly are in balance, then it also behave like ama. In clinical setting, we have seen that glucose toxicity play a significant role in the genesis of diabetic complication. In the same way, if excess glucose is there, it also damages the architect of hepatocytes, and it enhances the steatosis of fat content in the hepatocytes or accumulation of fat. If lipid content is high in transportation system in the channel, then it also accumulated in liver, not only liver but also the other side of the body. Then the Garavisa is also a concept of Garavasa is mentioned in Ayurveda. And Dusi Visa is also, these are the residual content of the things which is accumulated, and in due course of time it may lead to genesis of not only liver disease but other types of disorders. Then Ayurveda describe another concept. One is Lina Dosha. Lina dosha is present due to improper or inappropriate management of diseases. Like certain diseases, if not managed properly, then the dosha is accumulated in the body channel or dhatus, and in due course of time, by acquiring the etiological factors, it may lead to provoke the disease or genesis. It may lead to genesis of disease. So lean dosha is also a very important factor described in Ayurveda. Then Medo Sanchaya is another culprit, and Madhya intake of Madhya and Nidanartha Kara Roga. This is also very important factor. Means a variety of diseases also initiate the process of hepatic disorders. Like cardiac problems, the patient from congestive heart failure may lead to develop congestive hepatomegaly. The liver architect is highly compromised. Means one disorder create another disorders. It is mentioned in terms of Nidanartha Kararoga. Variety of fever. We can also elaborate here the infectious concept of, like in Acharya Sushruta mentioned Sankramak Roga, Kushtam Jaram Sosascha Netra Vishanda Evacha. Like a fever, variety of fever may also lead to infectious fever may also lead to hepatic disorder in this context, like malaria, malaria, Kala Ajar, and schistosomiosis. So, some infective disorder, like viral disorder, is also act as a Nidanartha Kalaroga. Some viral infection is at some other site. It may be transported toward the site of liver via our Srotas. So Nidanartha Kalaroga is also, so in some time diarrhea is also associated with hepatic problem. So certain diarrheal condition like Pitta Tishara may lead to develop. If Pitta Tishara is viral, like in case of viral diarrhea, if your integrity of GI is broken, the virus is absorbed in the system and reaches to the liver. It may lead to develop liver disorder, hepatic disorders. Then I am here trying to integrate the Ayurvedic pathogenesis. what we see in the context of hepatic disorder. May lead to Raktadushti. The blood is vitiated and it may, in modern terms, hepatocellular injury. If Raktadushti is there, it in modern may free radical may lead to hepatocellular injury, altered hemoglobin breakdown that may lead to hemolytic jaundice. So Raktadushti is there, and further we see the Pitta Dushti. If Raktadushti is there, so due to its similarity with Rakta dosha, Rakta, the Pitta is also vitiated. So it may lead to liver inflammation like hepatitis, non-alcoholic steatohepatitis, or drug, any kind of drug uh, which is chemical in nature, it directly vitiates the pitta dosha in the system. The pitta dosha which is situated in the liver, then liver functioning is disturbed and it creates hepatitis and other type of disorders. And pitta dushti is there. Further, it may cause srota roda, obstruct the body, means obstruct the channel. Either it is related with vials, either it is related with veins, like the Srotodosti is visualized in hepatic vein, aneurysm of hepatic vein. It is known as, in case of Vadacheri syndrome. It may also lead to congestive liver disease. The liver is soft in nature and pulsatile in nature. Means the drainage of vein is not reaches up to the higher side, not means not reaches to the heart. So channel or bile obstruction, srota or roda. If bile is obstructed by any means and measures, this may lead to cholestasis, fibrosis, and bile duct blockage. So srota or roda is there, and yakrata vriddhi. Finally, it may lead to liver dysfunction, and it is described in modern terms like fatty liver disease, hepatomegaly, and if liver is prolonged affected by these disorder, the further inflammatory cascade is initiated inside the liver. It may lead to develop liver cirrhosis. Liver cirrhosis is the outcome of fibrosis due to damage of hepatocytes. The cirrhosis is there. If cirrhosis is there, it may further lead to obstruction of body channel. If channel is obstructed, like in case of that we see the in case of cirrhosis, we see the portal hypertension. The portal hypertension is due to fibrotic change of hepatocytes, means the drainage system, venous drainage system of liver is highly compromised. In case of liver cirrhosis, it may lead to not only portal hypertension, and portal hypertension may further lead to other types of variceal disorders. There is a bleeding tendency at different sites. If cirrhosis of liver is there, this may lead to portal hypertension. It may lead to ascites. It may also lead to melena, like bleeding of blood from the anal site and bleeding of blood from the oral route. So these type of things are visualized in case of cirrhosis. If cirrhosis is prolonged, then we see the different type of Ayurvedic disorder with contemporary correlates. Like Kamla, we see the Pitta and Rakta Dushti. Kamla as a whole is comparable to acute hepatitis or viral hepatitis, and this may lead to jaundice. The parallel term Kamla and other one is Sakhasrit Kamla. In Ayurveda, one is Sakhasrit and other is Koshasrit Kamla is described. So Sakhasrit Kamla is the outcome of any type of obstruction in the biliary tract. If there is a biliary tract, especially gallbladder, if gallbladder are common, there is a obstruction in common bile duct. The bilirubin is not excreted in the second part of the duodenum, and if bilirubin, there is excess bilirubin in the costa, maybe it is circulated to the whole system. Sakhasrit Kamla, the bilirubin is the constituent of bilirubin is not visualized in the stool. Like stercobilinogen, there is a deficiency, prolonged deficiency of stercobilinogen in the stool. Sakhasrit Kamla, and we see the feature of Tilipist Nibhagu Barsha, like clay colored of stool is visualized in case of obstructive jaundice. Then we see the Kumbh Kamla. Kumbh Kamla is comparable to cirrhosis associated with ascites. This is advanced stage of Kamla. And Halimak, there is a chronic liver disease with CNS involvement. Halimak is associated with Hatendriya, Ojachaya, Valachaya. These features are clearly mentioned in the classical text of Ayurveda, and CNS impairment is clearly visualized in chronic liver diseases. Therefore, it is comparable to Halimak and Yakrit Odar. Yakrit Vriddhi is comparable to hepatomegaly. Yakrit Daleodara is liver cirrhosis. Pandu plus Kamla. If Pandu is associated with the Kamla, then we can say that it is comparable to hemolytic jaundice and alcoholic hepatitis. Because intake of alcohol not only damage the liver, but also damage the formation of Rakta Dhatu. So liver alcohol intake is strictly prohibited. Then we try to integrate with molecular hepatology. The Ayurvedic pathogenetic, in what way Ayurvedic pathogenetic is comparable to molecular hepatology? Like AMA in Ayurveda, it may be compared as endotoxemia, and free radical and lipopolysaccharide induced injury. If anyone try to assess the AMA strength, you should try to assess the parallel endotoxemia, free radical and lipopolysaccharide in the system. And Pitta Dushti, the component of Pitta Dushti is comparable to inflammatory cytokine cascades, especially like TNF alpha, interleukin 6, interleukin 3, 2. These are the sub-inflammatory cytokines which play a significant role and comparable to the Pitta Dushti of Ayurveda. Rakta Dushti is there. So Rakta Dushti may directly hamper the functioning of hepatocyte. And in molecular hepatology, it is comparable to hepatocyte necrosis and accumulation of bilirubin inside the hepatocytes, Rakta Dushti, and Agnimandia, especially Bhutagnimandia may related to mitochondrial dysfunction and poor oxidation. So these are the some I should try to assess in this way the Agnimandia of Ayurveda. And further the Kayachikitsa, like antioxidant and regenerative effect. In molecular hepatology, we assess the antioxidant and regenerative effect. And if we utilize the Kayachikitsa in the management of liver problems, liver disorders, not only viral hepatitis, but other types of hepatic disorders too. Then what are the common symptoms visualized in case of hepatic disorder? I herewith comprise the some common feature which is observed in clinical practice in variety of hepatic disorders. The first thing which is mentioned in modern medicine is jaundice, Other one is fatigue and malaise. There is a abdominal pain. There is a nausea and vomiting, anorexia, dark urine, fever. Some hepatitis is associated with fever, some are not. Pale or clay colored stool, pruritus, excessive itching in the body. It takes place if there is a excess bilirubin in the shakha, in the circulation. Then it may be observed the ascites and edema, bleeding diathesis, encephalopathy, palmar erythema, weight loss and muscle wasting. So these are the some important features which is acquired from the contemporary hepatology. In Ayurveda, if you observe this feature, similarly in Ayurveda, the feature is described here like a klama. Klama is an important feature of Kamala. Klama malayati hantiti Kamala. Klama, like lassitude. Without any work, patient feel excessive lassitude, excessive weakness, and hanti. The oja barada and bala of the patient is greatly hampered in these disorders. Etymology of Kamala is very important in this context. Klamam layati hantiti kamla. Klama is initiated if any types of weakness. Patient say that if we feel problems since 4, 5, 6 days, excessive weakness in the body, then you should try to assess the liver function. You should also, klama is also a feature of diabetic patient. So you should also try to assess the blood glucose. So klama is an important feature in haridra netratoka. Like electric presentation of eyes and skin. It is visualized, it is mentioned. Agni mandya is there, weakness of Agni function is there, Aruchi is there, Udar Sula is present, Abhipaka, indigestion. If liver is hampered, functioning of liver is hampered, the digestion of food particle is not appropriate. And Pita Mutrata is also mentioned, Pita Mutrata and Pita Varcha. Stool is also yellowish or dark yellowish in color, depending upon the presence of bilirubin in the system of circulation. Mursha is there. There is in advanced stage there is a Mursha condition. Gaurav, Daurbalya, Jara, Shotha, Panduta, Yakrita Vriddhi and diarrhea. These are the feature also. If we screen the classical text of Ayurveda, ranging from Kamla to the Roga, these features are especially visualized in Ayurveda, and in the same way, the feature which is mentioned in the contemporary medical science, it is well documented and comparable to the Ayurvedic point of view. Then we see the diagnostic of Ayurveda, in what way different types of hepatic disorder is diagnosed. So Ayurveda clearly assess that the rogam ado parikshet. First you should examine the disease, and then you should try to assess the strength of the patient. Means rogi and roga pariksha is very important as per Ayurvedic perspective. The rogi assessment is not clearly documented in contemporary medical science. For the assessment of a roga, various pariksha is described in Ayurveda, particularly like Nidana Panchaka. We can see, if we see the Nidana Panchaka, we can assess like Hetu. On the basis of Hetu, you should try to assess the Hetu. What are the causative factors? Like hepatitis is there. So you go through the history taking for the assessment of Hetu of particular disorder, not only hepatic disorders. The Hetu assessment, etiological factor assessment is very important, because these factors not only assist to diagnose a disease, but etiological factor also play a significant role in the management of diseases. Roga hai na? So Hetu Pariksha is very important. Then Purv Rupa, Upasaya, and samprapti should be assessed. Different types of samprapti is described. So should be assessed at your level. Then Ayurveda describe Dasavid Pariksha and Ashtavid Pariksha. Ashtavid Pariksha is especially designed for the assessment of strength of disease, and the primary aim of Dasavid Pariksha is for the assessment of strength of patient का स्ट्रेंथ क्या है, तो उसके लिए 10 वेद परीक्षा की जरूरत है। उसके आधार पे आप अपनी औषधियों को देने का प्रयास करेंगे। एंड अष्टवेद परीक्षा तो is also very important to assess the strength of disease. Disease is mild form, mild, medium and severe form of a disease is assessed on the basis of Ashtavid Pariksha. In reference to Kamala, Mutra, Mala and Netra Pariksha is very important. Like if Mutra is yellow in color, means the strength of hepatitis is mild in nature. If it is dark yellow, the strength of hepatitis is moderate in nature. If it is greenish or severe dark in nature, urine, then you can assess the severity. It is very grave sign and severity of hepatitis. The Mutra Pariksha, you should try to assess Mutra Pariksha of Ayurveda on its color, quantity, sediments and other things. Then Mal Pariksha, on the basis of Mal Pariksha, we can assess we assess the Kamala. Kamala is either if it is Sakhasrita, then we see the clay colored stool, Tilpishta Nibham Barcha. If there is a complete obstruction of bile duct, common bile duct, then only clay colored stool is visualized. Otherwise, if it is partial obstruction, then Tilpishta Nibham Barcha is not visualized. Therefore, the assessment of Kamala on the basis of Ayurveda, we cannot clear that it is Sakhasrita or Kosthasrita. If there is a complete obstruction, then we can say this Kamala is Koshtha Sakhasrita. If obstruction is partial in nature, then we cannot say that it is Sakhasrita. Then it is always Sakhasrita or Kosthasrita in nature or both in nature. Koshtha Sakhasrita Kamala. Then what we need to differentiate Kosthasrita and Sakhasrita, then we need to use and utilize the contemporary tool and technique of modern diagnostic. So it is very important to assess the exact cause of obstruction. It is stone obstruction, it is tumor obstruction, or obstruction due to enlargement of other organ or other associated structures. The variety of things are assessed by the use of contemporary tool and technique. Netra Pariksha in this concern also very important. Netra Pariksha is very important to assess in patient of jaundice or in patient of hepatitis, particularly viral hepatitis. Then you should try to assess the dosha samurchana. Means dosha samurchana, the interaction of dosha and dosya. In Ayurveda, two types of things are described. One is Prakriti Samved and other one is Prakriti Visham Samved. Means the outcome of disease is based on the similar cause. If it is this type of samurchana, like alcohol intake, if there is a causative factor similar to alcoholic hepatitis, then this samurchana is known as Prakriti Samved Samurchana. If cause is other and disease is alcohol is hepatitis, then it is considered as Prakriti Visham Samved Samurchana. Like in case of variety of infectious condition, in case of Jora, if Jora is there, like in case of cardiac problems, if cardiac problem is there, then there is a chances of hepatitis. hepatitis, congestive hepatitis is there. Liver is a congested and palpable in nature. So those samurchana is a very important things should be kept in mind while assessing the diseases of hepatic disorder. Then ama and pitta lachana should be examined. These are also a feature. It is initiated with ama dosha or it is associated with pitta dosha. Then ama assessment is always kept in mind in Ayurveda for the assessment of a disease. Then we come to the modern diagnostic. From here we can reach the appropriate diagnosis. What type of hepatitis is this or not? Then we assess, we all know that we assess the liver specific biomarkers, which is especially related to liver, like like SGPT, serum glutamate, glutamal pyruvate transferase enzyme, and other one is SGOT. This is a liver specific enzymes which is visualized if the cause is associated with liver, then SGPT is highly elevated. Like in case of hepatocellular injury, either it is drug induced or it is toxin induced, either it is alcohol induced. Directly it initiates the chances of hepatocellular injury. Hepatocellular injury, SGPT is highly elevated. Another one is aspartate aminotransferase, SGOT, which is also indicate hepatocellular injury, but the condition which I have mentioned, especially SGPT, is very important. In SGOT, the other disorder are it is also elevated in some other disorders, like disorder of prostate, disorder of bone, disorder of cardiac. So SGOT is also raised in such condition. If you see in clinical practice, SGPT is normal and SGOT is elevated, then it indicates that this type of problem associated with cardiac. If the liver is congested, like congestive hepatomegaly, due to cause of cardiac problem, in this condition, the SGPT and SGOT is also highly elevated. So cause and effect phenomena is very important to assess the different enzyme function. Alkaline phosphatase and gamma glutamyl transferase reflect cholestatic liver condition, like alcoholic like cholesteatosis, non-alcoholic cholesteatosis. There is accumulation of fat content inside the liver. Then GGT, gamma glutamyl transferase is elevated. In some other conditions, GGT is also elevated, like in case of hepatocellular carcinoma and some other tumors. Alkaline phosphatase is especially elevated in case of disorder of gallbladder. Either it is related to stone, either it is related to like cholangitis, yeah, cholecystitis, yeah, gallstone. Alkaline phosphatase is elevated in such type of clinical condition, and bilirubin level raises. If these enzymes are altered, the function are elevated, the ultimate there is a chances improper secretion of bile to the second part of duodenum. The level of serum bilirubin is also elevated, and it further may lead to hamper the liver function. Means bilirubin induced toxicity is initiated in the liver, inside the liver. Albumin and prothrombin time should be assessed for synthetic capacity of the liver. So albumin and PTNR in chronic disorder, PTNR assessment is very important. It is if it is up to 11, 12, it is okay. If it is beyond this, then there is a chances of in highly compromised liver condition, like in case of cirrhosis or malignant jaundice, the PTNR level is highly elevated, and there is chances of bleeding diathesis from different sides of from different opening of the body. Then we assess, you should try to assess the serological and immunological test. Like for hepatitis B, we assess HbSAg, ABEG, anti-HBC, and IgGM and IgG. So these assessment for hepatitis B and for C, we assess anti-SCV antibody and anti-SCV RNA test for hepatitis C. And similar types of pattern is also associated with affection of hepatitis A and B. Then we assess the ANA, SMA, and LKM antibodies for autoimmune hepatitis. ANA is especially in case of psoriatic arthritis or other types of autoimmune disorder. So, liver is also associated with autoimmune hepatitis. In the presence of autoimmune, certain other systemic autoimmune illness, it may or may not be associated with autoimmune hepatitis. Then avoid like advanced biomarkers like alpha fetoprotein should be assessed for assessment of hepatocellular carcinoma. Ceruloplasmin help in diagnosing metabolic liver disease, like in case of Wilson's disease, and for the assessment of copper accumulation in copper industry areas. If anyone is suffer with jaundice, then if at the site of copper industry, then it is a duty of physician to assess the ceruloplasmin level to those patients, and non-invasive fibrosis markers like FIB4, APRI, and HEPA score. For this purpose, we should try to carry out fibroscan test for gaining utility in case of chronic liver disease to assess the strength of liver damage, and we should try to plan our management accordingly. Then we assess the elastography is more accurate or fibrosis than transient elastography. The elastography is also required. Some dye are pushing for the assessment of magnetic resonance elastography is assessed for this purpose. Some dye are pushes to assess the architect of hepatic and venous pattern of liver. Then we carried out certain tests to assess like ultrasound. It detects hepatomegaly, liver fatty liver cirrhosis, portal hypertension, and Doppler. USG Doppler is used for to assess the hepatic blood flow. CT scan useful in trauma and suspected malignancy. MRI and MRCP is to assess the architect of liver parenchyma, GB and bile ducts. So for this purpose, MRI and MRCP is important to assess the extent of hepatocyte damage. Then we see the approach of management. We can integrate at this level comparative approach of management of hepatic disorders like hepatitis B and C. In case of in modern medicine, certain antiviral drugs are used and some life supportive measure is given. Some nutritional supplement is given. Otherwise, there is no any appropriate management. Antiviral drugs like tenofovir, entecavir, these are drugs is prescribed to lower down the viral load up to some extent, but it is act as a lean dosha. And in due course of time, if there is a precipitating factor, the virus is further replicate and enhance their progeny in large number. So appropriate management is still continued. The development of appropriate management is still continued in contemporary science. So if we use antiviral drugs, it is okay. But side by side, we should also try to use our proven antiviral drugs, which is carried out in preclinical setting in vivo and vitro. In vivo and vitro studies in hepatitis B and C, certain drugs of Ayurveda, which is Tikta Rasa Dravyas, like Kalameg, Bhonimba, Guduchi, Vasa, these are especially effective in nature in cases of hepatitis B and C. It not only correct the liver enzyme, but also regenerate the cells of liver which is damaged. Means these drugs not only lower the viral load, it also lower the viral load and also lower the hepatic enzyme which is derailed in case of hepatitis. It is also lower the viral load along with these important drugs also have potency to regenerate the hepatocyte because the liver is also a very important regenerative organ. If a part of liver is like there is a hepatectomy in case of certain clinical condition, then the liver try to regenerate itself to its normal way. So liver has immense healing potential and regenerative ability. So in this way, Ayurvedic drugs help to regenerate, to potentiate the action of liver by helping regeneration of hepatocytes, liver cells, NFLD. There is no appropriate drug for the management of non-alcoholic fatty liver disease or non-alcoholic steatohepatitis. Some drugs are trial under the trial, like glipron and pioglitazone. And pioglitazone is also not very appropriate drug. Pioglitazone is used for the management of diabetes. GLP-1 analog is also used for diabetes management, and the same drug is also there. The moderns, the contemporary scientists are trying to utilize these drugs in cases of non-alcoholic fatty liver disease. But in Ayurveda, we can try to our own way, like Ayurveda advocated the like Agni Deepna measures, Pachana measures, Virechana. Virechana is very specific for use of Virechan therapy is very specific in Kamala cases. Kamali to Virechana is mentioned. So it is not only Virechan is not only clean the livers, but also have regenerative ability. If liver is clean and healthy, then it has regenerative ability. It acquires regenerative ability by the act of Virechana therapy. And in this context, we use Trifala, Mustak, Faltrikadi Yoga, Devdara Vyadi Yoga, and also the things which is described in context of Nedoroga. The variety of drug described in the context of Nedoroga are in case of diabetes, non-alcoholic fatty liver disease should be managed on the line of Prameha, on the line of Nedoroga, on the line of Sthaula Roga, along with on the line of Kamala Roga. So there are so many approaches to manage non-alcoholic fatty liver disease. Alcoholic liver disease, only abstinence to avoid alcohol intake is mentioned in modern medicine and use of some corticosteroid and nutrition. Otherwise, there is no specific drug for management of alcoholic liver disease in Ayurveda. Appropriate for the management of alcoholic liver disease, Ayurveda mentioned like Madate Chikitsa. Follow the guideline of Madate Chikitsa. Abstinence is not described Charak to decline the Madhya in Padanshik Krama. Means Padanshik decline and use Madhya in the management of Madhya Vikara, like alcohol induced liver damage, like Dracha Rishta, Amrita Rishta. These Rishta are very Trifala Rishta, Trifala so. They are effective in the managing the alcoholic liver disease. So Draksha, Haritki, Amrita and Rasayan drugs are very useful along with some Virechana. I would like to say here some important things. Virechana, Sansodhana therapy is very simple procedure. You should not try to utilize the Bhamana procedure in case of Kamala Roga. hepatic disorders, because liver is already compromised in nature, and hence therefore, and the Vaman karma is a very drastic procedure. Lot of exercise is carried out by abdomen and liver in the process of Vaman karma pittanta. Therefore, Vaman karma is strictly prohibited in case of virechana, and virechana should be used in cases of Kamla Roga in the care of this, in the care of trained physician. Cirrhosis, in the management of cirrhosis, there is no appropriate medicine in case of modern medicine. Only some diuretics, beta blockers, albumin, and liver transplant is the ultimate aim. But in Ayurveda, Mirudha Virechana, Vasti, Punarnavadi Kwath, Pathya, Ahara, and rejuvenation therapy have a potential to manage the cases of cirrhosis. Variety of Ayurvedic physicians are managing the cases of cirrhosis up to large extent by utilizing the principles of Ayurveda and some Rasayana measure, especially like Trifala Rasayana and Vardhamana Pipli Kalpa. Vardhamana Pipli, increasing dose of Pipli is given to the cirrhotic patient, and it is adjusted up to a particular level along with milk intake. The milk intake should be encouraged in cases of liver cirrhosis along with use of Vardhamana Pipli Kalpa, or if it is not available, then you should use Chausat Prairie Pipli Chuda for the management of liver cirrhosis along with some other Ayurvedic drugs. Management of ascites, only salt restriction and paracentesis diuretics are indicated in case of ascites. Ayurveda has enormous scope in terms of Lekhan Vasti, Tikta Drabbe Pana, Sotahar drugs like Punarnama, Daru, Haridra, and other for the management of ascites. In case of hepatocellular carcinoma, if carcinoma is there in liver, then there is only a resection of particular part. If whole liver is involved, then there is a need to transplant the liver or chemoimmobilization used towards chemotherapeutic measures and some biologic like sorafenib. Sorafenib we use for the management of hepatocellular carcinoma, but their role, specific role, is still doubtful in modern medicine. Ayurveda not cure. We cannot say that hepatocellular carcinoma is curable by the intervention of Ayurveda, but we care such type of patient in a better way by utilizing Ayurvedic therapeutics like use of Trifala, Haridra, Daru Haridra, and Bhallataka for the care and management of hepatocellular carcinoma. These drugs not only progress the not only check the carcinoma, but also check the progression of disease up to a large extent. Therefore, these drugs should be tried. So these are some comparative Ayurvedic drugs in drugs which is mentioned in classical texts in other contexts can be utilized in case of hepatic disorders like Bhunimba, Kalmega is indicated Pittahara and Kamala Chikitsa. It enhances liver enzyme protective and hepatoprotective in nature. Guduchi, Agnivardak and Rakta Prasadak. It acts as anti-inflammatory, hepatoprotective and antioxidant. Kutiki, Yakrata Uttejak, Pitta Rechak, described as a Pitta Rechak drugs. Any types of Pitta disorder is there, or Rakta Doshti is there. The Kutiki is the very important drugs. Kutiki not only detoxifying the effect, but restore hepatic functions. The Kutiki is the best one drug should we try to use. And Pudarnava is mentioned as a Sota or Mutrala, useful in ascites and fatty liver. Rifala is Pachak and Rasayana, as well as Mridur Virechaka. Reverse fatty liver changes. And Haridra indicate like Vishujanya Vikara. Haridra is the best one drug. Someone trying to stop the Haridra intake, but it is indicated in case of hepatic disorders. So anti-fibrotic and anti-hepatocellular carcinoma, and Haridra is also antioxidant. Haridra is not only in Kamla disorder. Haridra is in variety of clinical condition along with other drugs. Then we see the what is the limitation of allopathic treatment in hepatic disorders. Here we see the lack of curative treatment for many chronic conditions. In modern medicine, in spite of many advances, the appropriate management of cirrhosis, chronic hepatitis, and non-alcoholic fatty liver disease have no definitive cure in allopathy that we see in the previous slide. Management is often supportive. Only supportive management is there, focusing on slowing progression or managing complications. Otherwise, there is no definite cure in contemporary medical science. Drug-induced liver injury. Many allopathic drugs can cause hepatotoxicity, requiring drug withdrawal or liver monitoring. So drug-induced liver injury is also like prolonged use of corticosteroids and biologics in case of autoimmune disorders or in case of alcoholic hepatitis. It further damages the liver. Then so there is a chances of further liver damage. Allopathic drugs which is used for the management of hepatic disorder itself leads to hepatotoxicity. Then we can say our site is better than that. In advanced condition, in emergency condition, we can take help from other system of medicine, especially allopathy. Limited regenerative focus. Regenerative focus in Ayurvedic medicine, in modern medicine, the regenerative focus is totally lacking. And for the management, Ayurveda describes Kayachikitsa for liver cell restoration, like use of Triphala Rasayan, Vallatak Rasayan, Guduchi Rasayan. So these drugs have the regenerative, like Punarnava Rasayan, regenerative ability. Dependency of lifelong medication. In modern medicine, patients with hepatitis B and C or other autoimmune disorders may require lifelong antiviral or steroid with significant side effects. Side effects and systemic burden. Their approaches, many medication burden to the liver, like above line use of steroid, liver burden that may lead to systemic side effects. Therefore, they have no scope for prolonged use, neglect of preventive aspect. Allopathy often focuses more on treatment than prevention. The target is treatment, target is disease, prevention is no any measures. Without the preventive aspect, we cannot alter the pathophysiology of deranged pathophysiology of liver. Without the preventive aspect, we cannot alter the pathophysiology of deranged pathophysiology. Then become the different domains of integrated research. Come to the point of research, then we need to the different domains of, if drug is not mentioned in the classical text, then there is a need preclinical domains. What are the preclinical domains which is already carried out in past decades? Ayurvedic herbs have been tested in vivo and vitro models for hepatoprotective activity. I here mentions few drugs only, like Calmega. It proven as hepatoprotective against CCl4, carbon tetrachloride induced hepatotoxicity. So this is in animal model. The Calmega not only lower the range hepatic enzyme level, but also reverse the toxicity of the liver cell, like Guduchi Tinospora cardifolia, immunomodulatory and hepatoregenerative effect. This study was carried out by Sharma et al. And paper is published in Phytomedicine, like Kutiki, Icrorhiza coroa, comparable to silamarine in non-alcoholic fatty liver disease. Kutiki is the best one drug for the management of non-alcoholic fatty liver disease or other cholestasis problems. This study was conducted by Joshi et al. In 2018 and published in Indian Journal of Medical Research. And Punarnava Punarnava against paracetamol induced liver damage in rats. Study was conducted by Mehta et al. It normalized the hepatic enzyme level, improved histopathology. Paper is published in the journal. In comparative antioxidant activity of individual component of Triphala, found that these drugs are Triphala. The component of Triphala is having ability to reduce the raised liver enzyme and also protect liver from the toxic damage. Then I here we try to put some clinical domain which is conducted and published in the important some important journals like efficacy of Punarnavadi Mandura and Triphala in non-alcoholic fatty liver patients. It improved the liver function test and ultrasound fatty liver grades. So different grades are selected. So these are also minimized by the use of Punarnavadi Mandura. And other one is Kalamega plus lifestyle intervention. The study was conducted by Das et al. In chronic hepatitis B for 12 weeks and found that it decreases alcoholic ALT and AST level, SGOT, SGPT level and improved in fatigability. The study was published in this journal. Effect of Drakshadikvata and Guduchi Sattva in liver enzyme normalization in case of alcoholic liver disease. Reduction in GGT. It is very important. Drakshadikvata and Guduchi Sattva, and it also reduces serum bilirubin. It is taken from the CCRS clinical series. Bhumi Amla in non-alcoholic fatty liver disease, like SGPT dropped over 12 weeks. It is find out. Kalme in acute viral hepatitis found that it reduces bilirubin and also reduces raised serum enzyme and faster recovery. Saxena RC et al. Phytotherapy research. Bhumi Amlaka. It is very important drugs and found effective in cases of hepatitis B in clinical settings. It reduces in HbSg titer and also reduces the viral load. Hepatitis B virus DNA load and liver enzyme. It is mentioned in Kirtikar and Basu Indian medicinal plants. Vashadikvat in cases of hepatitis B. This study was conducted under our supervision by Anupam Srivastav and found that it reduces the viral load, also reduces the raised enzyme level, and also reduces the lipid profile. The Vasadiquat is also found effective in cases of hepatitis B. So these are the some leads which can be taken from the clinical, and there is a need to do enormous preclinical studies in any model for the genesis of neo evidences, or you should try to approach your research in the line of reverse pharmacology. The drug which is in reverse pharmacology approach should be applied, like drug mentioned like any drugs like Faltricadi is mentioned for the management of the same is also tested of hepatic disorder. And to provide evidence what contemporary use today. So from this aspect, we should always try to do to develop standard polyherbal formulation under cover of biochemistry and biology for the management of hepatic disorder. Conduct multicentric RCT. This condition is lacking in case of Ayurveda. Our study are always conducted to a particular site and it is bind up in the thesis, and rest in the library, department, either departmental library or some other. So there is a need to conduct some multi-centric trial by taking some advanced project from ICMR and other funding agencies to conduct this type of trial by intervention of Ayurvedic plus modern regime or modern drug alone, explore Rasayan therapy at adjuncts to modern treatment, initiate Ayur plus hepatic integrative care protocols. So these are the futuristic goal which is needed to establish Ayurvedic hepatology in terms of contemporary hepatology. What Ayurvedic, what is the importance of Ayurvedic treatment? Ayurveda का महत्व क्या है in case of hepatic disorder? Ayurveda clearly mentions a prime motto to every therapeutics is avoidance of etiological factor. One disorder we can prevent. Avoidance of etiological factor, we can prevent certain types of hepatic problems. Holistic Ayurveda has holistic approach for its management, not only targeting the liver but also correcting the root of imbalance, like imbalance of pitta dosha, imbalance of pitta dosha, agni, and ama dosha. So these Ayurveda have holistic approach, safe and natural therapies. Ayurvedic drugs are approximately same safe in nature and they are adapted from green resources. So they are adapted from green resources, therefore they are safe in nature. Like these drugs known for hepatoprotective, anti-inflammatory and antioxidant properties with limited side effects, which is conducted on animal model. Management of chronic and non-curable conditions. Ayurveda has scope for the management of chronic non-curable conditions like cirrhosis, fatty liver disease, and autoimmune hepatitis. Which modern drugs not reversed, but Ayurveda focuses on improving quality of life, showing disease progression, and enhancing the liver function. In this action, we can say that we can minimize the complication and sustain the life for coming few years. So in this type of disorder, Ayurvedic drugs can be used and adjuvant. These are the chronic disorders and they are life-threatening in nature, autoimmune disorder and cirrhosis. So Ayurvedic drugs can be used as adjunct the contemporary modern drugs, modern drugs and approaches. Detoxification therapy type of measures is not visualizing the conditions. Variation is one of the important Sansodhana procedure of Ayurveda, specifically indicated for the pitta-related disorders, especially liver. It helps to clean the liver and whole, including blood, and it especially focus on diet and lifestyle. These are very important approach of Ayurveda. Ayurveda has soft approach for the management of such type of disorder. So these measures and things should be utilized not only for the management of hepatitis, but the other disorders too. One is very important classical Sansodhan therapy for hepatic disorder. Sansodhana, especially Virachanam Pittanam to Virachanam Sreshta. The variety of Sotha type of disorders here is mentioned like Akrita Vikara, Kamala, Halimic, Liyadosh, Panduroga, Udarroga, and Sotha. In these conditions, we should try to use Virachana therapy. But in case of acute onset or fulminant hepatitis, this type of means classical Virachana is not indicated. Classical Virachana is required, preparatory procedure, main procedure, and after procedures. So these classical Virachana form is not intervene in the cases of acute hepatitis or in the cases of other congestive hepatitis which is induced by cardiac problems. Otherwise, Mridu Virechana types of drugs are advocated. So, if Pitta Virechana is performed, like in clinical condition like chronic Kamla cases, it reduces the bilirubin. Classical Virechana. Here we mention the classical Virechana. Classical Virechana indicated in chronic Kamla cases. It reduces bilirubin, resolves jaundice faster. In cases of non-alcoholic fatty liver disease, it reduces fat accumulation and normalizes enzymes, liver enzymes. And in case of Pandu, enhances absorption and correction of anemia. Because it is indicated if there is a Pandu, there is an indication of a Tishana Virechana is indicated in case of Pandu Roga. It cleans the integrity of GI tract and also the architect of liver. Therefore, there is a absorption is better and there is a correction. So it is Ishun Varechana, especially in Pandaroga, it corrects the nutritional balance. Any type of nutritional deficiency, then you go through the Ishun Varechana, which is mentioned in Ayurveda. In case of ascites, it reduces fluid accumulation. In case of hepatitis, it supports liver repair, reduces bioreplication in combination with herbal. Bioreplication, it is not alone, but in combination of some other antiviral drugs, which is conducted in preclinical data, it should be intervened with duration therapy. It surely not only reduces the liver enzyme, but also reduces the viral load. Finally, we can conclude that the concept of hepatic disorder is in Ayurveda is moving around the pathophysiology of Yakrita Vriddhi, Kamala Roga, Madatya and Udar Roga. Means the drugs and measure which is mentioned in these conditions, we should try to utilize for the management of such type of disorder and also further go for the clinical research. The recent clinical and pharmacological evidences strongly support that hepatoprotective, immunomodulatory and regenerative role of Ayurvedic herbs and formulation are found effective in its care. In this way, Ayurvedic management can emerge as a safe, cost-effective and complementary tools in the holistic care and management of liver disorder. Ayurvedic herbs and formulation are found effective in its care. Finally, thank you. In this way, Ayurvedic management. Thank you all for your patience hearing, and also thanks to the head of the department of Kayachikitsa, Ajay Patel, Ayurvedic College,
For your insight.
and my
There
dear
are some
friend
questions.
Dr. Yogesh Dole, which has given me an opportunity to interact with you. If any queries, please ask me. For your patience hearing, and also thanks to the head of the department of Kayachikitsa, Ajay Patel, Ayurvedic College, and my dear friend Dr. Yogesh Dole, which has given me an opportunity to.
Yes, Dr. Manpreet, please ask the questions if you have.
Yeah, sir. Actually, there was some technical issue. First question is, Acharya Sushruth has referred for Rakta Dhatu Panchbhautik. So what is its role in hepatic diseases?
Yes, Dr. Manpreet, please ask the questions.
Rakta Dhatu is Panchbhautik. Not only Rakta, every content, every Dhatu is Panchbhautik in nature. So in Ayurveda, Panchamahabhuta is converted into Panchamahabhuta is converted in for the assessment of Tridosha. The Tridosha is the replica of Panchamahabhuta which is present in the nature. You should try to assess the component of Pitta. Panchamahabhuta as a whole is a very difficult task to assess in the human body. Our Acharyas clearly conceived the idea of Tridosha, means physics into biology. For the assessment of biological function, Tridosha measurement and assessment is very important. The Pitta component should be assessed, and Pitta is very similar to Rakta. Our Acharyas clearly conceived the idea of Tridosha, means physics into
Thank you,
biology.
sir. Next question is that Rakta Nidan and Kushti Nidan.
Measurement and assessment is very important.
Is there any correlation between hepatic diseases, skin diseases,
Pitta is very similar to Rakta. Your voice is not audible.
Nidan and Kushti
Your
Nidan?
voice is, I am unable to answer because your voice is not very clear.
Next question is that Rakta Nidan and Kushti. Sir, am I audible?
No.
Is there any correlation between hepatic diseases,
Hello.
skin diseases,
Your voice is. Hello.
Nidan and Kushti
Your
Nidan?
voice is.
Sir, am I audible?
Unable to. Yes. Because your voice is not very clear. Yes. Yes.
Sir, there is a question that Rakta Nidan and Kushti Nidan.
Hello. Raktaj krimi nidana.
Sir, am I audible?
Yes.
Kushti Nidan, sir. Kushti Nidan and Krimi Nidan, as mentioned in Charak 117, there are some similarities in them. So the question is that is there any correlation between hepatic diseases and skin diseases?
Any type of krimi, either it is large in nature or it is micro in nature. Micro krimi is considered as Jantava Adava in Ayurveda. The any krimi which is a micro in nature, not only in case of Kushta, but other type of disorder also. So Raktaj krimi only not related to Kushta. Raktaj krimi, we see the in the context of Kushta, but the Raktaj krimi is also we see the context of other diseases too. Ayurveda has given a concept in relation to Rakta, like in case of infectious disease. Infectious disease is also Jantava Adavo, infection of adu forming microorganism, which is also act as a also we see the context of other diseases. If it is comes in the context of Rakta, disease is also Jantava Adavo, infection of adu forming, because Rakta krimi in relation to Kushta, it is not directly linking with the hepatic disorder in Ayurveda. But in the context of Rakta krimi in relation to infectious disease, those relation to Kushta, it is not directly linking with the hepatic disorder in Ayurveda. Hello. But in the context of Rakta. Hello.
Hello, yes, sir. You are audible, sir. Hello. Hello.
No, sir. Any other question? Hello, sir. आवाज क्लियर नहीं आ रही.
Hello, yes, sir. Hello. Hello. Hello.
आवाज क्लियर नहीं आ रही.
जी सर, एक मिनट.
हेलो सर, आवाज क्लियर नहीं आ रही. Audible to me?
Hello.
आवाज क्लियर नहीं आ रही.
जी सर, एक मिनट.
Audible to me?
जब चालू तो Hello.
Hello, am I audible, sir?
Yes, sir. Yes, yes.
जी जी sir.
अब आ रही है, अब आवाज आ रही है.
Oh, sir, next question is, can you please suggest a rasayan for prevention of hepatic disorders?
Hello.
Hello, am I audible?
Take it. Yes, sir. On daily basis. Yes, yes.
जी sir.
अब आ रही है, अब आवाज आ रही है.
Oh,
Like
next question is,
intake of Ritu Haritiki. The best one rasayan or drugs.
hepatic disorders.
Haritiki is also very effective in case of. It acts as a vata on the lumen and also act on the liver. Amlaki is best one rasayan drugs. You should take on daily basis. Rasayan like Amlaki. Amlaki is a daily preferable drugs. So Amlaki is wonderful drugs. But other rasayana drugs like Pipli and rasayana drugs like Bhalataka, you should try to avoid it in daily routine and other in clinical practice too. Especially Amlaki and Hariti is very specific in case of liver disorder, not only liver but for the prevention of other type of disorders. Haritki and Amlaki is recommended from our side, and I also recommended to our patient too. Especially Amlaki and Haritki, because we cannot take Purnama for prolonged time. If patient liver is active, his health is active, we cannot prescribe people for prolonged period. Charak indicated that people chara and lowered is not used for prolonged period because it is clay the karaka and those prakopaka in nature. To prolong use of people is also try to promote the chances of hepatitis and accumulation of fat in the liver cells. So their prolonged use not indicated. Like Kutiki is also not indicated for prolonged use, though it is rasayan. The best one rasayan is Amlaki and Haritiki. Also try to promote the chances of hepatitis.
sir, many
Amlaki on daily basis. On daily basis. Their prolonged use not indicated. Like Kutiki is also not indicated for prolonged use, though it is
Thank you, sir. Next question is that many people are targeting Ayurveda for liver toxicity these days. So please share your views on this. Sir, many
generally okay. We can say that Ayurvedic drug is safe because it is obtained from green resources. It is obtained from green pharmacy.
many people are targeting
But its prolonged use is
toxicity these days.
also need
Share your views on this.
to be tested in due course of time. Means I have already pointed out that there is a need of centric trial for prolonged period. Our studies is based on only 1 month, 15 days or 3 month follow-ups condition, not more than 3 months. The clinical studies which conducted in Ayurveda is not more than 3 months. So on that basis, we cannot say that our drug is safe. Our drug is safe, but we cannot say that our drug is totally safe for prolonged period. We cannot मतलब ऐसा हम कह नहीं सकते. इसके लिए हमें लंबे शोध की जरूरत है, लंबे कार्य की जरूरत है इस पे काम करने की. Then we can say that our drug is safe because we use diet and lifestyle. If we follow the guideline of diet, ऐसा हम कह नहीं सकते. डाइट हमें लंबे शोध की जरूरत है, लंबे कार्य की जरूरत है. लाइफस्टाइल और ईटिंग डिजायर is chapati and you should try to eat more than 4 चपाती और पूरी आयुर्वेद में जब आहार और विहार दुष्प्रभाव उत्पन्न कर सकता है तो लंबे समय तक जो औषधि दी जा रही है उसका भी दुष्प्रभाव हो सकता है. हमारी दवाएं सेफ हैं, हम कह सकते हैं इन कंपैरिजन टू मॉडर्न मेडिसिन, लेकिन हमें उस पर लंबे समय तक कार्य करने की जरूरत है. यह हम सभी की जरूरत है, केवल आपकी नहीं. हम जो भी चिकित्सा कर सकता है तो लंबे समय तक जो औषधि कार्य से जुड़े हुए हैं आप रिसर्चर्स फॉर 1 hour, 1 year, 2 year, 3 years, then we can say that we use the drug for 3 years. लेकिन हमें उस पे लंबे our drug is safe, and various markers related to the assessment of safety and efficacy, and other markers, kidney markers, for prolonged period, time to time assessment, then we can say. Hello.
Sir, जी sir, thank you sir. Next is that
Yes.
autoimmunity is very common these days. So can we adopt specific medications or specific criteria for that?
So in autoimmunity, in Ayurveda, variety of in Ayurveda, autoimmunity as such not mentioned in terms of in Ayurveda. But AMA and AMA-like reactive species we can compare with the autoimmune markers. So relation of AMA with autoimmune markers. I have told that ANA antibody, especially elevated in the case of SLE, and in cases of like RA condition, anti-CCP is elevated. So you should try to compare the strength of AMA. There is a need of our to develop AMA strength in our classics. How we assess the quantity and quality of AMA in Ayurveda. Then we try to assess the quantity and quantity of autoantibodies in autoimmune disorder, and then we see the safety and efficacy in what the term. तो दोनों तरफ से हमें काम करने की जरूरत है. हम पहले अपनी तरफ से आम स्ट्रेंथ को असेस करने की कोशिश करें और उसके कंपेयर में ऑटोइम्यून, क्योंकि बहुत से ऑटोइम्यून डिसऑर्डर हैं जो लंबे समय तक शरीर में रहते हैं और जल्दी खत्म नहीं हो जाते. आयुर्वेद भी मैनेज करने के लिए सिंपली आयुर्वेद किसी भी डिसऑर्डर को जड़ से खत्म करने की बात करता नहीं है. We physician claiming that we totally 100% cure such type of disorders. Ayurvedic acharyas never pointed out that we hit the root cause of a particular disease. Only those, like in case of Panchakarma is mentioned that dosa kadachit kupyante jita langan pachane jita sansodhanayati natesham punradva. Where is the concept of doshic imbalance? We can prevent the doshic imbalance by incorporating the Panchakarma measures. To prevent proclaiming that dosa vyadhi kadachit kupyanti jita langan pashe jita संशोधनयतु नतेषां पुनरुद्भवा. ऐसी कंडीशनों में हमको व्याधि लिमिट है, उस लिमिट को पहचानना है और उसके हिसाब से मैनेज करना है. बहुत से ऑटोइम्यून डिसऑर्डर हेपेटिक डिसऑर्डर में कन्वर्ट हो सकते हैं, लाइक रूमेटॉइड आर्थराइटिस. देयर इज ए चांस to convert hepatitis, liver problems. SLE may convert to liver disorders. So in such type of condition, there is a chance to convert immune approach of management of Ayurveda should be. SLE may convert to liver disorders. In RA, the same is not treated by autoimmune diseases. So, dual approach is applied for the management of autoimmune systemic condition and autoimmune hepatic condition. Do you follow me?
Yes, sir. Yes, sir. Thank you, sir. Thank you so much for sharing with us your fruitful insights on hepatic disorders. We are grateful for you. You're sparing your time for the informative webinar. Thank you so much, sir. Now I would request Professor Dr. Dept, sir, for vote of thanks. Yes, sir. Yes. Thank you.
Thank you, Dr. Manpreet. On behalf of Department of Kayachikitsa, GJPIASR, I would like to propose the vote of thanks and concluding remarks. Actually, our principal ma'am she is busy with some UGC 2F work, so she's not available for the concluding remarks. But I must congratulate you, sir, for giving the experience-based, evidence-based insights on the topic and sharing your information with all our students. We have received around 190 registrations, and all our UG scholars, PG scholars are listening to you through the YouTube stream as well as Google Meet. So I'm thankful to you, sir, for accepting the invitation and delivering a wonderful lecture
Thank
for
you.
us. Thank you so much, sir. I am thankful to the CVM
Thank you,
University.
sir.
Thank you, sir. I'm thankful to CVM University President Engineer Bhikubhai Patel, sir, for always inspiring us to arrange such programs. CVMU Registrar and Secretaries for supporting GJPISR College. Our inspiring leader and director principal Professor Sarita Bhutada ma'am for taking initiative and always encouraging us for arranging the programs. Dr. R.D. Patel, sir, Director of this medical campus, and Dr. Kirti Patel, ma'am, Hospital Administrator, for supporting us. Our HOD, Dr. Kendre, sir, and all the faculties of Department of Kai Chikitsa, they have been busy in the celebrations of World Hepatitis Day today since last 15 days. And actually, we had a Sahita Pathan on the Charak Jayanti also for Khadu Kamala Chikitsa. Then we had a camp in the morning about hepatitis awareness, and also we had poster presentation by the UG and PG scholars. So those events were in the morning, and the evening, the afternoon session has been blessed by your gracious presence. So that has been a wonderful day on the celebration of Hepatitis Day with you, sir. I'm thankful to all the UG students, PG scholars, PhD scholars, and all the faculties of GJPISR for sharing their insights and attending the program. And I'm thankful to Mihir Bhai also for the technical support, and all the UG students who are listening. They are listening for their syllabus points, but they have been enriched with the advances of Ayurveda management in hepatic disorders through this platform blessed by you, sir. And thank you, one and all, to you, sir, especially. Thank you so much. Dr. Manpreet, you can conclude the session.
Yes, sir. Thank you so much, sir.
Namaskar.
Namaste, sir. Thank you so much, sir.
Now, with this, we will conclude our webinar. Thank you so much, sir.
Namaskar, sir. Thank you, sir. Thank you so much.
Yes, sir. Thank you so much, sir.
हाँ नमस्ते 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 सर